what would you suggest a mom who just had a baby or is about to have a baby should do in terms of dentistry, in terms of like doing the right thing in terms of oral health with her baby, and as the baby grows up, a child?
The first thing I usually tell the parents, especially the mom, is to frequently check and see when their child's teeth are erupting. They can usually tell because the baby usually is uncomfortable. But they should get the baby in the habit of having the teeth cleaned. And this can be, this doesn't have to be an uncomfortable thing. There's very soft, comfortable little brushes that the mom can start using. And again, it's just getting the child used to having their teeth cleaned, because cavities can start at a very, very early age. It's not unusual to see a 2 or 3 year old child with a lot of cavities. So that does occur.
Is it true that that moms should avoid to send the child asleep with a bottle in the mouth, because kids love to fall asleep with a bottle in the mouth, juice or milk.
I would like to think that's I would like to think that's common knowledge, but maybe it isn't, Helen. The sugar in the milk product that just stays on the teeth 7, 8, 9, 10 hours a night. It'll destroy the teeth in no time. So yes, that's definitely a no-no.
Okay. And when should a mom bring the child in it kind of the first time? What do you suggest?
Again, it depends on the child, but I like to have most kids checked, most babies by the time they're 2 or 3 years old. Again, it depends on the development of their teeth, okay? And especially if the parent suspects any problems, she sees dark spots, or the teeth aren't coming in, then, they may want to go to the dentist a little bit earlier. At the age of 2 or 3, we typically recommend for moms to take their child to a pediatrician, which is a dentist who specializes in treating children of that age. In our practice, we typically start seeing the children between 4 and 5. I'll be the first to tell you, a lot of times when we see the children between 4 and 5, that's the first visit they've ever had to a dentist. That's not necessarily a bad thing. Most of the time the kids are okay, but if it was my child, and my recommendation would be to start the child off at a pediatrician at the age of about 2 or 3.
All right. Thanks a lot.